Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And I also work as a life coach to help people around the world with the non medical aspects of their weight. So if you're on a GLP-1 and you can't get yourself to the gym, or you're not sure how to eat, or if you want to never start a GLP-1 and you just want to make really sustainable lifestyle changes, I can help you with that. So I'll leave all that info down below. But before we start, very big news. The FDA has approved Zepbound, aka tirzepatide for weight, as a treatment for sleep apnea, which is great news because that type of weight loss definitely helps with sleep apnea. And it means that if you have sleep apnea and you've been struggling to get that approved, you may have a much greater likelihood of getting your insurance to cover it now. And we'll see if it helps for people on Medicare. That would be great if insurance covered that for people on Medicare. That would be amazing and help millions and millions of people. So I'll leave that link down below and you can read all about it. But anyway, that's great news. So let's get into the questions. As always, I can't answer personal medical questions because I'm not your personal doctor. But if your question is a little more personal, I'm going to change it a little so it's more broadly educationally applicable. And let's get started. So first question. Okay, I've just been prescribed Mojarro, but I haven't started taking it yet. It seems more often than not I've fallen into the rare category for side effects on various medications throughout my 61 years. I am diabetic and have autoimmune disease, so I'm very reluctant to start. This is a very common concern, especially for people who, they feel like they're always the 1% who get side effects, or some people they're like, I live alone. If I had side effects, I'd be really worried. And I think those are always very legitimate concerns and things you want to definitely discuss with your doctor. I would also say that, there certainly are side effects to not starting a medication as well. So, especially if you've kind of done everything that you can do on your end in terms of lifestyle changes, if you've done all that, you and your doctor feel like it's a good idea for you to start the medication, but you're really a little shy or hesitant to start it, there are downsides of not treating a BMI of 30 or above. It does place you at higher risk for a lot of other medical issues, including diabetes, many different types of cancer, joint pain, like the list is long. So there's a side effect to not taking the medication too. And the nice thing about these medications when they're physician supervised is that you start out at a very low dose, and the goal is not to blast you. The goal is initially to let your body get used to the medication. So yes, every once in a while I have a patient who feels like that first dose is just like straight food poisoning. That's pretty rare in my experience. Most people, they don't love the first dose, but it's also not the end of the world for them as well. And the nice thing is often that your body does adjust to this medication over time. And a lot of times the side effects just get better. So think about it. Think about your reason for not starting, and do you like it better than your reason to start? That's really the decision that you want to make, and have a conversation with your physician about possible side effects, what to do if you have side effects. And you also might be somebody who doesn't have side effects on this one. So that definitely happens for people as well. They really tolerate the first doses very well, and still have weight loss. So that can happen as well. Again, especially for those people who have kind of maxed out their lifestyle changes, this would be the next tool to help them. And what would be your reason to start it versus not start it? And which one do you like better? So that is a great question. And I know a lot of people are very hesitant and worried. Next question, I've gone from 148 down to 216. And my A1C went from 6.7 to 5.7. That's amazing. However, after stepping up, this is on tirzepatide. After stepping up to the 10 milligram dose, I've had diarrhea for almost 2 weeks now, but otherwise I feel fine. Okay, so again, definitely if you've had consistent GI side effects, you want to talk to your physician. But if I had somebody who I'm checking in with, and they're like, I've had diarrhea for 2 weeks, That's really good to know about because I want to make sure that they're staying very hydrated, that they're still able to eat, that, the nutrition is coming in. And then oftentimes, it really depends on the person, depends on other side effects that they're having. It depends on other medications that they're on, other medical issues that they have. But, Imodium is always a great tool for some people. And you do just want to keep an eye on, bowel movements per day. I think this, for my question list, is going to be a GI heavy office hours. So I'm fine with that. I really talk about this all the time, so it's not a big deal. But if you are somebody who doesn't like to talk about it, you might want to come back for the next episode. But yeah, I mean, Imodium. Also, sometimes you do want to check in with your doctor because, especially people in their 50s and 60s, that's often a times where inflammatory bowel disease presents itself. So, what you don't want is to be thinking that this is a medication side effect, but it's also, oh, this is the start of Crohn's disease. So, these are just some things to be aware of, or some people do have food poisoning at the same time. So if I have somebody who's having it consistently, I'm going to do a workup for other things other than medication side effects. But if I feel like this is really primarily just due to the tirzepatide or the semaglutide, then I think a limited use of Imodium can be very helpful for people. It's over the counter, and then a lot of times the medications do go away with time. I'm sorry, a lot of times the side effects do go away with time. And also check in and see what I'm going to check in and see what this person is eating, because that can also make a big difference too. Some people, they might need to avoid lactose. Some people might need to avoid heavy fatty foods. Like, that's all going to make a big difference. So that's what I would do if somebody came in and they were talking to me about this issue. Next question. I am 69. I've been on Mojarro since June 2003. I've lost 76 pounds, but notice I don't lose as much weight around the middle as easy as like most younger people I see. Other than that, I do great. Oh, congratulations. So this is another thing, and I talked about this a little in my video about menopause, but for women after menopause, it's not like menopause is like automatic, you gain 20 pounds. That's not what happens. But what does happen is the weight gets redistributed. So you notice weight in different areas. And of course, their fat distribution on their body is also different from person to person. So for any person, there are going to be some places where they're going to lose weight easily and first, and there are going to be places where they lose weight less, or that's kind of the last place where it will show. And that's going to be different for everybody. But for this person, if you were somebody who maybe 20 years ago, you lost weight more easily around the middle, this could also be just hormonal. And so, chat with your doctor, make sure nothing else is going on. But if you've noticed that the weight is a bit more hesitant to move around that area, you've optimized your lifestyle changes and your strength training, and you're doing all those things, that might just be one, how your body is, or two, also related to hormonal changes. And a lot of times the fat distribution, it can be around the middle. It can be subcutaneous, so that really superficial fat, but it also often is visceral. So it's it's more deep internal fat around the organs. So that can happen as well. Of course, the medications are going to help with all fat loss, but it's not a surprise if it's less noticeable that you're losing weight from around the middle and you're menopausal or postmenopausal. That is certainly an area that can be more hesitant for the weight loss to come off. And that's just hormonal. That's just life. So, not surprising, but think about these other things. It might not be something that changes with the medication, or it changes, but just not as much as other areas. And that's just related to age, stage of life, and all those things as well for some people. So thank you so much for that question. That was a great question. And lastly, okay, how do I combat constipation? I have lupus and diabetes and take meds for those. Please help. Okay. So if somebody comes in and they're experiencing really significant constipation, that's definitely something that you want to get a hold of, because really severe constipation can have pretty dramatic side effects for people. You can get a small bowel obstruction. It can be very uncomfortable. There's lots of other medical issues that can happen as a result of severe constipation. So you really do want to get a hold of it. So definitely check in with your doctor, make sure nothing else is going on. And usually this is a time where I am going to work with somebody pretty closely on getting a good bowel regimen for them. Stool softener, laxative, sometimes Miralax can be helpful. It depends on what, okay, again, not to be gross. I mean, I talk about this all the time. This is just my job. But you really want to like get into the details of like what's going on with the stool so you can better treat it. So talk with your doctor, but you might need a couple different kinds of bowel. Like if I have a patient who's coming in with this, they might need a couple different types of bowel treatments or bowel medications. And then there's certainly like the really subspecialized things that your physician or your GI doctor can prescribe to you, like Linzess, things like that. But and of course, you want to also discuss with them, make sure you're up to date with your colonoscopy, you're not having bleeding, like all these other things. You definitely want to check in with your doctor about any severe GI issues on these medications, but constipation, don't let it go too long. This happens for a lot of people as a side effect. It's very common, but you really want to get a hold of it and then eventually figure out what works for you, because you don't want it to get worse. So those are some things that I work with patients on, but definitely I find often you need a combination of bowel medications to help fix the problem. And I also need to titrate it quite a bit and make sure you kind of have to play around with it a little and be patient and track what works for you. This is where data monitoring is really helpful. Keep a symptom journal. That's really helpful as well. So I'll often have patients keep a symptom journal, and that is really helpful as well to see exactly what's working and what's not. So these are all great questions. Thank you so much for watching. This will be the only video for this week because it's a holiday week, but I'll be back next week with more Ask Me Anything office hours questions. Thank you so much for watching, and please be well.